Hey guys, this is Mark Poole. Thanks for checking out my video on Plavix. And the question, is Plavix a blood thinner? It's something I talk about with patients when it comes to heart surgery, heart health. A lot of patients are on aspirin or Plavix. When we talk about heart surgery, it's important to know whether they're on these agents because it can influence or impact bleeding around the time of the operation. So something we talk about a lot in terms of heart surgery, but a lot of patients I think have a vague understanding of how Plavix works or what it is. They often talk about it like it's a blood thinner. Indeed, Plavix is not a blood thinner, or at least I should say someone like me who likes to split hairs, there is no agent that truly thins the blood as if it's going to decrease its viscosity or something like that. But what most people mean is that it will reduce the blood's propensity to clot. But Plavix is not an anticoagulant in the same way as Coumadin or heparin or some of the strict anticoagulant agents. Plavix is an antiplatelet agent. It's similar to aspirin in that way, and I often talk about it like a super aspirin. It's just more powerful than aspirin for most patients. It binds certain sites on the platelets and makes them less prone to clumping together. So the way I think about it, and this may not be strictly scientific, but this is just one surgeon's take on it, is that your whole body, the blood vessels are lined with specialized cells called the endothelium, and your body's used to that. The blood slips through there, no big deal. It knows what it's up against. It's like the lining of the pipes is perfectly you, and the blood just keeps moving. Of course, by God's design, you always want the blood in your body to keep moving, and if there's an injury or a tear or something like that, for the blood to quickly clot. So it's a complex situation. Well, if there is an injury or a violation of that wall of endothelium, certain proteins are exposed that are not usually in the bloodstream, and platelets will tend to clump, to adhere, to attach to those proteins. That somehow activates the platelets a little bit and makes the other platelets nearby more prone to clumping to those, and before you know it, you have this big platelet clump, which then activates the factors, the proteins in the blood itself, to create a solid blood clot. So when you cut your finger, some of those proteins are exposed, platelets start to adhere to those proteins, they start clumping, other blood factors get involved, and you end up with a nice blood clot that prevents you from bleeding to death from just a small cut. Something we take for granted, but I mean, if you think about it, it's quite amazing. A similar thing can happen during a heart attack. Oftentimes, it's not the plaque that built up through the years that causes an acute heart attack. It's a plaque that was in there that somehow ruptured, and new proteins are exposed to the blood flow that weren't exposed before. Platelets clump to it, clump, 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 more and more. Blood factors get involved, and you get a blood clot that completely blocks up that artery. That reduces and impedes, stops the blood flow to the heart muscle, and a heart attack results. That's why it's important often to give a dose of aspirin as soon as you can if somebody is having a heart attack, because it can help reduce that effect at least a little bit. So this is what Plavix does. It stops those platelets from binding or adhering or sticking to one another as easily, and can help keep the blood flowing. So for instance, if a patient gets a new stent, that is a foreign body. It doesn't have that special endothelium, and the platelets may recognize it as foreign and may be more prone to clumping within the stent, clogging it up and causing a big, huge problem. So we put the patient on an antiplatelet agent to keep those platelets moving through there and less prone to clumping and clotting up the stent. By contrast, an anticoagulant, a true so-called blood thinner, works on the factors of the blood to prevent a blood clot from forming, even if the platelets have already clumped, and if there's a clot already involved, to help prevent that clot from getting bigger. So if a patient has a blood clot in their leg or a blood clot in the artery of the lung, a pulmonary embolism, an antiplatelet agent is not going to do any good because the clot has already formed. So you put the patient on an anticoagulant to help prevent the blood factors from continuing to increase the size of that blood clot. So hopefully that may help with the distinction between Plavix and anticoagulant agents. Plavix is an antiplatelet, not an anticoagulant, and they work by different mechanisms. Some patients may actually be on both. If you have any questions related to this or other matters of the heart and heart surgery, by all means, please contact me by Facebook or email. Be happy to answer any questions that you have. God bless you today.